Most cases now, we're seeing record number of cases and transmission in this country, and we're seeing states with transmission and positivity rates that put them in some cases in the high teens, 20, 30, some cases 40% positivity rates. Obviously, it's raised some alarm, raised some concern, and I want to jump in and give you the latest here in our state. As you can see, our case numbers have been trending up as well. The 7-day average at 5,889 number of tested positive for COVID-19. Yesterday, the number came in over 7,000, 7,212. That number was familiar 4 to 6 weeks ago, but since the early part of October, where we were able to get those numbers down below 3,000, we haven't seen an average of 7 days above 5,800 in quite some time. Let's take a look at the positivity rate. As you can see here, the positivity rate, again, the percentage of people that are tested and those that are tested positive, that positivity rate's at 3.7%. I should note just on October 19th, not too long ago, a little less than a month ago, when I made a presentation, the positivity rate over a 14-day period was at 2.5%. So 2.5% October 19th, when we provided you this information, now at 3.7%. In the last 3+ weeks, we've started to see not just the average number of people testing positive go up, but also the positivity rate go up. And I'll remind you why I make that point and make that distinction. We are not ashamed of testing people, quite the contrary. We want to see more tests, and you're seeing in this slide 143,711 average number of tests that we have conducted on a daily basis. By the way, yesterday was just shy of 194,000 tests. So we're getting close to 200,000 tests. That would be close to a record number of tests. That is aided by this new state lab, PerkinElmer, that we announced just a week or so ago. That lab is just getting up, just a few thousand tests being conducted a day, now over 40,000 cumulatively since the lab opened. But that state lab will provide at peak upwards of 150,000 additional daily tests, additive to the existing protocols that are already in place in terms of testing availability. But nonetheless, we're seeing the average number of daily tests go up. And when you're testing at this level, we anticipate seeing more cases. But it's the positivity rate that we track with points of obvious concern. Percentage of people that are testing positive gives us a sense of what's really happening. Background cases, number of what we saw surveillance cases as relates to what's happening in communities large and small all up and down the state. 3.7%, 14-day positivity rate in this state. Hospitalizations, not surprisingly, we've been tracking this. We have been previewing this as well for a number of weeks now as we started to see a rate of decline begin to mitigate. We started to see some stabilization in the hospitalizations. And a few weeks ago, we started to see some increases in total number of patients with COVID-19 in our hospital system. As you can see here, just over the last 14-day period, it's increased 28.6%. So that trend line continues up, and I'll give you a sense of what that means to total system capacity, represented here in this slide. It's 4% of our total healthcare system capacity. So I want to put that number in perspective. We can run with headlines on case rates, but I think the more important number is positivity rate. We can run with headlines as it relates to new cases that have entered in our healthcare system, but I think capacity is the area of focus for us, and capacity we have been building, and capacity we have been focused on. 4% of our entire healthcare system capacity now has COVID-19 patients. Let's take a look at ICUs in the state. Those are also tracking, not dissimilar to hospitalizations, back up. 27.3% increase in the total number of ICU admissions over a 14-day period. And let's take a look at what that means in terms of our critical care capacity throughout the state. It's about 11% of the total number of ICU beds and those that are available in our system. We still have over 20,000 ventilators available, 20,390 in the state. These slides are familiar. And these slides are important, and these slides will become even more important as we move back indoors, as people begin to mix outside of their households, as we see these winter temperatures increase the likelihood of people coming into our system with respiratory issues, with related flu symptoms, this twindemic that we're all anticipating into the winter months. Obviously sobering, these numbers, but again, the total capacity that we built out, the ability to test being substantially greater than it was just even a few weeks ago, let alone a few months ago, and the ample inventory of over 500 million masks and other related PPE is significant. And that number of N95 masks, procedure masks, surgical masks is unprecedented in terms of our total storage and cash in our system. All of that, in addition to what the healthcare delivery system is providing directly for themselves, meaning what the hospitals are procuring directly, our state hospital support combined with ventilators, both in the state inventory and individual clinics, not just hospital primary care, and throughout the entire system is substantially greater than it was in the beginning of this pandemic. Just trying to give you an overview of how we prepared in anticipation for what we refer to in this state as the second wave, and it's been referred to as the third wave, simple semantics, in other parts of the country. One of the most important things we focus on, and certainly all of you focus on, you look forward not to Mondays, but Tuesdays when Dr. Ghaly gives you an update on our tiered status. And remember, a number of weeks back, we came up with these first purple, the most restrictive tier, and the yellow tier, in addition to red and orange, the least restrictive. We've made tremendous progress since we began to socialize this new tiered status. I anticipate tomorrow you'll hear from Dr. Ghaly that we will see more restrictive tiering based upon case rates that have begun to increase. And look at places like Mono County, you look at Kings, Alpine, Shasta counties, you're starting to see an R effective rate growing, you're starting to see case rates growing. And so I anticipate, without previewing too much detail, of course on Mondays, late afternoon, early evening, we get all of the data and work through differences of opinion in some cases, or just making sure that we're all aligned with local health officers in terms of just the veracity of the data and the transparency of it before we release that information. But tomorrow at noon, we'll get that information from Dr. Ghaly, but anticipate that we'll see some counties moving backwards, not forwards. And this is exactly why we designed the tier status the way we did. It was about being more and less restrictive, not based upon political whim, but based upon the data, based upon the epidemiology, based upon the facts on the ground, and again, based upon local conditions in the 58 counties throughout the state of California. So the tiered system is working as it was designed. More on that tomorrow, but you can get a sense here based on the current tiered status now with 48 counties that are out of the most restrictive tiers, and more progress made into the red and orange counties last week when Dr. Ghaly gave his last update. Speaking of updates, tomorrow is a very important day for, well, hundreds of millions of Americans, not a exaggeration at all to say quite literally hundreds of millions of Americans. The prospect in California v. Texas, Supreme Court will hear oral arguments to potentially strike down the Affordable Care Act. The current administration in Washington, D.C. is advocating that the Affordable Care Act be struck down. As a consequence, we in California are vulnerable to a decision, the adjudication of that case, which will be a number of months away, but 6.1 million Californians with pre-existing conditions could directly be impacted by that Supreme Court decision. You hear often numbers that connect to the national scene, but here we're breaking it down so you get a sense of what this means for you here in our state, the most populous state in our union. 6.1 million Californians have pre-existing conditions. And don't forget, it is very likely, as we wash through COVID-19, the pre-existing condition of COVID-19 transmissions related to the COVID or the coronavirus also can increase and add to that number. You're seeing prospects of people who have limits on higher premiums due to their age and gender, those being impacted by this decision. And of course, those of us with kids, particularly those of you with kids that are younger than age of 26, the impact obviously on the ability to keep those kids covered on the parents' plans is also a potential impact of this decision. Let's put it in monetary terms. Let's put it in numerical terms, in terms of just raw health care coverage. Our Medicaid system in the United States of America is referred to as Medi-Cal here in the state of California. We are looking at the prospects of losing $20 billion, $20 billion in federal funding related to the ACA, the Affordable Care Act, if it's struck down. 3.5 million Californians have been beneficiaries of the expansion of our Medi-Cal coverage pursuant to Obamacare and the ACA that also could be vulnerable to that decision. $7 billion in federal premium assistance also could be at play. So add those two numbers up, $27 billion is what's at stake. When you read about the oral arguments tomorrow, you hear this debate, you hear these national numbers. This is your numbers, people here in the state of California potentially losing $27 billion of federal supports that would be impacted by this decision. We also have 1.5 million people currently enrolled in Covered California. That's our health exchange run by Peter Lee, who I will introduce you to in just a moment. Also potentially can lose their coverage if the Affordable Care Act is thrown out. These are jaw-dropping numbers. These are extraordinary times. Tomorrow's oral arguments are profoundly significant to each and every one of you watching. And I'll just remind you, there are many other things that the ACA covers, the donut hole, all related issues that impact you. If you don't think it impacts you because you're not on Medi-Cal, or it doesn't impact you because you're not on health exchange, I would encourage you to learn more about what the ACA does and does not do. And don't learn that from nightly cable. Take the time, actually learn a little bit more by investigating the impact, because at the end of the day, the entire system is connected to itself in one way, shape, or form. Old frame, many parts but one body. That's the healthcare system. And the impact of this unraveling in impacting you is profound. And so we, of course, the reason it's California v. Texas, have a very different point of view than the Trump administration, and we'll be expressing that during oral arguments tomorrow with representatives as well that advanced Obamacare with the incredible support of our own Speaker Nancy Pelosi. It simply would not and could not have happened without Speaker Pelosi's leadership as well. And having just had a conversation with her a few days ago on this subject, I can assure you this is top of mind in terms of her agenda, not just the oral arguments, but the what if and how we prepare for a what if scenario moving forward. Just something else I thought I'd bring up, talk about scenarios. We didn't wait around and look at the Affordable Care Act as a ceiling. We looked at it as a floor. We looked at it as an opportunity to architect something that no other state in America has done. And it's worth reminding people that there's no other state providing subsidies for middle-income families. These are folks earning 400% to 600% of federal poverty. At last count, those subsidies are over $500 a month. This is so often forgotten. It's rarely even referenced or mentioned, but we are providing, no other state in America, providing over $500, in fact, it's exactly $509 for middle-income families, subsidies on a monthly basis, first in the nation, to help subsidize the costs related to the Affordable Care Act. We also deepening subsidies for people earning less than 400% of federal poverty at about $21 a month. We're proud of that. And all of this, again, can be impacted if the ACA is thrown out. We're also going to hear from Peter in a moment, record low premium changes this year. Despite all of the vandalism by the current administration in Washington, D.C., premiums this year are going up. I know you heard the word up, but hold on, 0.5%. 0.5%, less than 1%, record low premium increase because of the success and the efficacy of not only the ACA, but the extraordinary leadership here in California, at Covered California, led by Peter Lee. We also have done things that no other state has done, and that's provide coverage to people regardless of their status. And you say, well, that's how dare we do that? Well, just consider you're paying for sick care on the back end through your premium. You either want to pay exponentially more in the emergency room or stabilize individuals by getting them a COVID test or getting them, a flu shot and eventually a vaccine, which we'll talk about in a moment, for COVID, so we don't end up infecting other people and impacting the entire healthcare delivery system. We just believe in the principle of universal health care from an economic perspective, as well as from a moral and ethical perspective. And so we're just proud of that. I wanted to bring that back up to your attention and remind you some of the things that no other state is doing, that California is doing, because of our commitment, not just passive interest, but commitment to provide coverage for all Californians.